So I'm talking about the application of data analytics and AI for post-COVID recovery and a big data smart future. I looked at the impacts of COVID-19, first of all, through the lens of the digital society. And by that, I mean the domains of health, education, work, and the home. It's from a UK perspective, for obvious reasons. And I looked at the impacts and in terms of positive and negative characteristics and the lessons to be learned from them. And then to compensate partly because of the UK perspective, I also had the findings of an international roundtable on how AI is presently being used in the fight against COVID-19. And then a look at some predictions. Next slide, on big data, AI, and analytics. I'm sure everyone knows those. So to be clear about what's meant by the digital society, it's basically the digitization of the use of technology of society in all its components, such as in the home, the workplace, and community. There's something called the digital divide, and that's where people who don't have the required technology, etc., to support it, then they're basically removed from the digital society. So the best example is being online. If you don't have access to being online, then you're missing out on everything that exists on the internet. The digital divide tends to be most acute for older age groups and those in relative poverty without the financial means for either the technology or the infrastructure. And this is known as digital exclusion. Next slide. COVID-19, again, I'm sure most of you know about this because it's been on the news indefinitely. It's a zoonotic disease. Some debate about its origins. It's highly infectious. Again, everyone should know this, but what is very perverse is that doesn't affect the young. In most cases, like flu, the young are equally hit to the very old, but it's one of the reasons why it spreads so greatly. And it is important to notice that political influences have played a part in the approach to tackling COVID-19. Next, several countries approached it differently. New Zealand and South Korea, they were used to MERS and SARS, had been through it before. They immediately closed their borders and went in for test, trace, and isolate. There's been quite a few events. In fact, this is whilst I was writing this paper, you've got new variants, which are now described as alpha, beta, gamma, and delta. New rapid development and approval of vaccines. There were 7 the last time I looked. And there's also a successful national vaccination program in adult populations in countries like Israel. And the UK isn't too far away. We also have something called long COVID syndrome for some COVID survivors. Next, please. Okay, Dom's already touched on this. Some vaccines have been developed using the traditional laboratory type approach, but there's also been vaccines, the latest ones being developed using genomic sequencing. Next, please. Okay, just to say that this is a mixture of literature and observation, lots of observations from lots of sources. You can imagine there's a huge number of sources saying the same sort of thing. And as I mentioned before, this is confined to the UK. Next, please. Some factors specific to the UK for those who don't know the UK or don't live here. Great Britain's an island. UK is and England and London in particular is a transport hub because people and goods go through it. Heathrow was once the busiest airport in Europe. The majority of the population is in cities. We have a national health service, which is important as you'll see later. There is there is devolved parliaments that operate, there are devolved parliaments that operate in the UK. So discriminating between political and scientific decisions isn't always clear. The focus is on England simply because there is more available data. Okay, so, oops. Okay, yes, thank you, James. Next. Okay, so there's some tables now on what was found. And please note that digital exclusion is applicable to all domain exemplars in the home. Next slide. Okay, so looking at health. Next slide, that's just a picture. Okay, so basically there are exemplars in health. I won't go through all of them, but for instance, online consultations. It's got positive impacts in that for patients with the appropriate technology, it might be better, it's easily accessible. The negative impacts, and these are common through other domains, it highlights the digital divide. If you don't have the technology, you don't have access to the healthcare. Computer-mediated communication, CMC, is never as good as face-to-face. A lot of diagnoses are made within the first couple of minutes of a patient entering surgery. If they walk with a limp, it could be gout, it could be a broken leg, but basically you can observe that. You can't really observe that if you just got somebody's face in a mobile phone or a laptop looking at you. You've got the lack of human-to-human interaction. There's a lot on HCI, but we need humans. Mental health issues. Oh, not too quick. It's all right, I'm not going to go through the others so much. Due to health service exclusion, you've also got more data being captured. And if you don't have the technology, you can be treated as a second class or feel like a second class patient. So the societal implication is basically expansion of e-health. Next page. Okay, so then I look at analytics being very useful, for instance, for COVID-19, used for test and trace, recognition of new variants. But then you've got issues of privacy and access to medical records. Again, the social consequence or asocial consequence is an expansion of e-health and genomics and continuation of test, track and trace beyond COVID. Next one, please.
All right, just a minute.
Okay, and then there's a mention of simulation modeling. That in itself doesn't have any negative consequences unless the information is used negatively towards the population. But there's going to be an expansion of the use of simulation modeling. Next, please. Okay, so we then looked at the domain of education. Next. And the main thrust of COVID has led to more online teaching. It's similar to health. It's great for people who've got the technology and got access to it. Like health, it highlights the digital divide. It's not as good as face-to-face, mental health issues, data capture, second-class service. But you've got the expansion of e-teaching as the societal implication. Next, please. Okay, work. So for work, the move has been towards online working. Similar to the other two, it's great if you have not only access to the technology, but your business has to fit in with being able to be online. If it does so, then there's been an expansion of the online presence, a reduction in commuting, so there should be less transport, less pollution, and also possible housing and transport cost savings, because you can live remotely. You can live somewhere nice and work somewhere horrible. So negative impacts, again, it's a repeat of the previous things. The main difference, though, is to do the lack of separation between home and work. There's also the loss of support industries, which is mentioned occasionally. So all the people go to work and they buy their newspapers and they have their coffee and everything. Obviously, they have been going out of business. The implication is the expansion of e-working. Next.
It freezes.
Okay, and I also mentioned about use of sensors and logistics. So you've got the tracking of tracing of individuals, and issues of privacy, likewise with mobile communications and technologies. You've got issues of surveillance. Okay, thank you. Continuation of that. Surveillance, closed circuit television is useful if you're looking after babies and old people, but the same thing can be misused. So you have actually got an expansion of e-surveillance, Big Brother in every sense. You can continually look at the activities of the population. Okay, thank you. The home. Again, this must be very relevant to people who are watching this. They're probably saying yes. I don't know how many people have joined things like Peloton. Positive, you've got online virtual communities. Negative, well, as a runner, I don't think it would replace the real thing, but you now have the expansion of e-leisure. Thank you. Likewise, we've all been watching Netflix, smart televisions. Again, it's useful for sharing things, being part of a community, but you do have issues about ownership of data, and of course, it can be misused. There's identity theft, fraud, etc., e-crime. So you've got the expansion of e-media. Next, please.
Right.
Oh, you made back one. Thank you. And likewise, smart devices for the home. So you've got smart meters. Again, useful for checking on the elderly and children. But you can actually get an awful lot of information from the data that these smart meters, etc., record. So you can find out when people are actually at home, when they work, if they're ill. Okay, but ultimately we're moving towards smart homes. Next one, please. Okay, so the use of AI to help scientists in their mission to beat the coronavirus pandemic was discussed at a virtual roundtable. And the main points are summarized later in the discussion. So we're going to skip past those, please. Next one. Next one. Thank you. So in the discussion, which also includes the roundtable highlights, post-COVID-19, the following trends are increasingly likely to become reality. Through lockdown acceleration, most of these things have happened faster during any period of lockdown. So we're going to have home-based, online and remote primary healthcare, with the initial face-to-face consultations being a rarity. Pre-consultation use of online query systems such as NHS Direct, that's our health service, or we have a telephone service. Many more online remote hospital consultations and the greater use of genomics and analytics. Home-based online and remote learning, blended learning is the norm for universities, but now schools are likely to have far more remote learning included or online learning. But that could lead to school and university closures, as well as the expansion of universities. Okay, thank you. Next. So home-based online and remote working to some degree, where and when possible. It's going to be on a case-by-case basis. And what I suspect is what we'll actually move to, it will be hybrid working. So it'll be a mixture. In fact, most things will be hybrid. It'll be a mixture of online and going back to the old normal. One of the positives could be that the smart motorways that we have in the UK could be removed. Basically, in the UK, they've had the hard shoulder removed and allowed traffic to go on it. So when people break down, there's nowhere to go, and then you have accidents, which could be avoided. Home-based online remote shopping and banking, further demise of physical shops and cash, home-based online remote leisure, virtual gyms, music and film streaming, and social media. Next, please. Okay, this is really promotion by NHSX, which is a digital version of the NHS. They are looking basically to use patient records as part of their digital transformation. They have been avoiding the GDPR and trying to come up with their own version because, again, people in the UK may or may not know their records were going to be used or whatever by the government, and you had to opt out. But they've held back on that because the GDPR says no, so trying to come up with their own version that says yes. And genomics new innovations in vaccine research produce pill versions of vaccines and vaccines that target the virus's shell with the actual genetic material. So that will lead to a universal vaccine that works against new resistant variants, or at least that's the hope. A positive is the pandemic may also have spurred research onto the first vaccine for AIDS and other illnesses like malaria. Firms as diverse as Google and Schroders have stated, although I think Google may have changed their mind, that employees need never return to the office with the behavior being changed. And in 2020, Amazon's sales, you'll be not surprised to hear, leapt by 40%. Next, please. So we've got, okay, and similarly for Asda, they reckon their online shopping has been accelerated by 10 years. So they'll be looking to reduce customer front-facing staff and back office staff involved in cash transactions, again, the demise of cash. So there'll be more delivery drivers and order pickers instead. Applying analytics and AI to COVID-19, the roundtable discussion highlighted the need for the early, safe and secure access to data, which was correctly labeled. That was a problem they found. Local and international collaboration and global sharing in public health emergencies. The strengths of having a national health service like the NHS and good communications with regulators and the scientific community. These were what they found were positives. They used AI for background research on relevant information on adverse effects of developed drugs. And they did this by shifting through medical papers as well as AI-driven contact tracing and a self-health check app for arrivals. And they also had AI involved in COVID-19 X-ray and CT imaging. AI was also deployed for identifying anti-vaccine sentiments. And what they did was they created dialogues with other users, people who use cancer drugs, and had that community speak to the anti-vaccine community to reassure them and persuade them. Next slide. The negative impacts of COVID-19 itself on society aren't always tangible. There are many more incalculable costs of the virus beyond death and infection statistics, such as disruption of primary care and education in a wider sense. And these intangibles, such as the impacts on mental health, loss of daily routine, lack of human interaction, non-COVID related deaths and diagnoses, and they all shine a light on the digital divide, educational, work, social and health inequalities. So the economy may bounce back, but consequences could lead to a lost generation, the young paying the cost, not only in terms of their education and mental health, as well as the long-term debt. Okay, next. Okay, so basically this just says about things being accelerated and what will be needed, better logistics and communications, and also to be aware of data harm. During the pandemic, there have been freedoms that have been curtailed, and laws have been changed to permit the unfettered access to some data, which will be fully reinstated after this pandemic. Next, please. So in conclusion, and I should just make the time, domains are all interconnected in the digital society. The home has become the classroom for some, the office, the cinema and the gym, and others have been totally excluded. From the trends identified, it can be seen that the main effect of COVID-19 on society has been the acceleration of its digitization, with the rapid, often untested expansion of e-health and genomics, e-teaching, e-working, e-logistics, etc., and smart homes. The pandemic, especially during times of lockdown, has demonstrated what you need to move to a digital society. You need the infrastructure and other things, and they're the things that you need to address if you're going to any society, especially if you're going to include all of society. So that includes those who are digitally excluded. Next, please. Okay, analytics can't be solve the problems in itself, analytics, but it can help. You can use it for diagnostics, for test and trace, often using a form of reverse engineering. Predictive analytics could be used to predict future outbreaks. Using the data we have now, lots of it as test data, and there's greater use of machine learning, and that's before we add Don's quantum approach. AI can and should be used to improve e-teaching, making it truly knowledge-based, and analytics and AI are already an intrinsic part of business, logistics, and communications. Next, please. Okay, so as I mentioned, they can't bring social change on their own beyond providing data knowledge to support that change. Post-COVID, the demand for greater integration of technology will act as a catalyst for smarter homes, smarter working, smarter schools and universities, smarter transport and so on, to smarter cities, with the UK heading for a fully digital or e-society. I think we'll hit hybrid quite soon. It'll be enabled by more big data, especially medical and logistical data, and AI will be embedded in many more activities. So we'll have smart cities and a contactless society using what I refer to as dynamic analytics. The event of big data smart future through AI analytics and the Internet of Things could lead to challenges in the actual view of knowledge, and we need to be careful of that. We mustn't be totally reliant on technology, and AI and analytics must be additions to, not replacement for, methods of scientific inquiry. Next, please. And as I mentioned, AI isn't a threat, but we need to be careful about automating and digitizing every aspect of human life. You have to consider the ethics, especially data harm. And that also includes the fact that things are recorded in perpetuity. The pandemic has also meant the realization of what's important as human beings. Humans are basically tactile and social animals, and society is essential to learning, to work, to health, and well-being. There is no substitution for human contact. There will be no humans in the long run. Next one, please. So in the post-pandemic future, I predict over the next 10 years, GPs in their present form will not exist. what's happened is during the pandemic, GPs have been more of an impediment or barrier to secondary care rather than an interface to it, and they've allowed themselves to be digitized, that interface. So they really would need to find a new, and possibly in hubs with other professions like dentists, where they would have physical interaction. Secondary care, hospital care, is unlikely to change immediately, but there will be perhaps greater use of AI analytics and genomics in diagnosis and prognosis, and more increased use. Next one. So in contrast with GPs, everyone's been very grateful to the teachers, and that's because teachers do more than just educate, as we've now become aware. And so the desire to digitize school education beyond support probably isn't desirable. Higher education, however, is much more vulnerable, and as a lot of universities have gone to strictly online, they may find themselves losing out in competition. There'll be a stronger business case for e-education in this sector. For e-work, I think it's going to be a balance between the benefits and likewise for employers on a case by case. The automation of many aspects of work will no doubt continue at pace, but society will need to be retrained to fit in. So jobs will change, and that leads to how are you going to pay for this? Because obviously we need to look at the financial ramifications for the automation of employment. Next, please. The futures all overlap with smart home, and unfortunately I think this is where the e-society will take place. The smart home could be the embodiment of e-society, because you can have smart homes at the end of the decade which will have smart sensors and interfaces, constitute hubs for all activities, work, leisure, etc. And new homes will be part of smart cities, which can be physically remote because of reworking, more akin to smart villages. So you have garages because you'll have driverless cars that you can just call for one to pick you up. Okay, depressing, isn't it? Next. And that means we should think more about the environment, green and social spaces. One of the positives is we have realized what's important in life and in this world. There are many benefits of an e-society, but the costs are likely to be personal autonomy and privacy if we don't take adequate care. So, as I said, it looks as if we're heading towards becoming fully digital or e-society. And unless we address the digital divide, we end up with an e-society, one connected and one isolated under just those questions.